PHA's podcast, and I'm your host, Anjana. Thanks so much for tuning in. Today I'm joined by Danielle Cho, who is a third-year MCDB major and a professional writing minor. Danielle is a part of the outreach team in Scope Patient Health Advocates, and in today's podcast, we'll be going over Danielle's public health interests, which includes some of her experiences at a soup kitchen in downtown Los Angeles. Danielle, it's a pleasure to have you on the podcast. Thanks so much for being here.
Thanks, I'm so glad to be here.
Awesome. So to start off, could you tell me a little bit about your background and where your interest in volunteering at the soup kitchen and how you, got introduced to that community?
Yeah, of course. So I started volunteering at this soup kitchen in downtown LA. It's called St. James Soup Kitchen about, I'd say, like a year and a half ago. And I started going there with one of the clubs at UCLA. It kind of helps members get to the soup kitchen because it is a little bit farther away. And as I was volunteering there, I just really, really realized how amazing of a community that the lead volunteer, Margaret Ecker, was able to build there. And that just really inspired me to keep coming back again and again, and to also want to work to kind of promote the messages that she's been working on and everything about the soup kitchen, actually.
Yeah, that's awesome. I know, hearing Margaret's experience, it's clear that there's a lot of really great work being done there. I'm interested, since you come from the outreach team in Scope, I assume you kind of brought some of that perspective to the soup kitchen. I'm wondering, how did you have to adjust your perspective in terms of outreach at the soup kitchen versus maybe what you're used to doing in clinic or with other community settings you've been in?
Yeah, definitely. So one of the perspectives I brought with me to the outreach team was that I wanted to use media to help communicate about different issues. I wanted to tell people's stories because I think a theme I've noticed throughout my time in college is that when we don't know people's stories, there's a tendency to other them or to stigmatize what we don't know. Mm-hmm. And that's something I really wanted to push back against with media, with telling people's stories. So that's something I wanted to do at the soup kitchen as well. And I kind of brought this up with Margaret, and Margaret is so wise. She has so much experience and she has so much wisdom. So when I brought it up with her, she was very supportive, but at the same time, she kind of cautioned me about what does telling people's stories look like in the context of maybe mental illness, in the context of substance use. So that's something I'm still grappling with. I'm still trying to figure out if it would be a good idea to proceed, and if so, what would be the best way to proceed with this. But yeah, those are just some of the considerations that I've been thinking about lately.
Yeah, absolutely. I think there are very nuanced, even ethical issues that have to be considered when, like you said, working with communities that are not used to maybe having their stories told, and certainly not in a positive light. So I guess to wrap up, seeing as those issues are very pressing, what are some steps that you think we could take maybe in the near future to kind of start addressing those things?
Yeah, definitely.
It's a big question.
Yeah, it is a big question. I'll sit with it for a second. I feel like I don't have all of the answers yet, and I'm not sure anyone or I or anyone else might ever have all the answers, but I do know that what I've seen at the soup kitchen has been really amazing. The fact that, I kind of alluded to it earlier, but I guess I didn't really explicitly explain, but the soup kitchen is not just a place where they serve food. It's really a community that they've made that people feel comfortable coming back again and again. There's personal relationships. There's Margaret knows so many other people who come back and again by name. And I think this really ties back to her philosophy of how sitting down with a person face to face, simply talking about them simply like kind of sharing that moment is enough, or not enough, actually, it's not enough, but that itself is a really big act that it kind of restores like your sense of dignity. It's like even in conversations that we have with the people around us, like if someone asks about you, it feels good. It just feels really good.
Absolutely.
And so I think there's no like exact science, there's no exact answer to this, I feel like, but simply the act of having this kind of place in downtown LA and for people to come back again and again, and for this like lasting bonds throughout time and like this reliability and this trust, I think that has like a really, really like maybe very hard to quantify, but like very, very important impact.
Yeah, absolutely. I totally resonate with what you said, and I'm hoping that, you know, even if there's no like concrete solution per se, that, you know, we find a way to maybe co-create something with the people at Soup Kitchen to get their stories out there and do so in the most positive way possible. So thank you so much for joining me today. It was a pleasure to have you on.
Thank you for having me, Anjana.
All right, that's all for today. Thank you so much for tuning in to Scope PHA's podcast. See you next time.